What a delight to be with you today. And my sincere thanks to the University of Ottawa team and to Kim for the invitation. I'm going to speak a bit about some of the opportunities that we're seeing, and I'm going to talk about this as both a clinician who is looking at what promises to be a very exciting decade for us coming with the implementation, integration of health AI technologies on the ward. But I'll flag up front that very little of that work has happened yet. And also thinking about it from a science and innovation perspective, and also, I think, finally thinking about it in terms of the crisis we face both geopolitically and economically, with a very disconcerting, I think, series of interactions with the United States, but also seeing how some of the innovation work that's being done in Canada is being increasingly offshored, and thinking about what we can do to bring that back on site, to bring that back within a Canadian context. So those are the brief comments I'll start with, and then looking forward to the conversation. So, starting with the unique opportunity, as someone who is on the internal medicine side of the hospital, we and at St. Michael's Hospital, we're considered here to be one of the most advanced data-driven hospitals in the country in terms of our internal capacity. But in my day-to-day practice, and as general medicine, we're about 40% of the volume of the hospital goes to our wards. There's only a single health AI technology that has become routinely integrated in our clinical practice in terms of how I make clinical decisions for patients. And that's an early deterioration system. And for most patients, for most physician encounters, aside from radiology in this country, no health AI technology has yet entered the clinical space in terms of decision making. So that on the back end, there's patient scribes and things like that. But in terms of how we actually make decisions around patients, nothing has really integrated into our system. We know that's going to change, and it's going to change dramatically probably in the next decade. And if I think back about a technology that was also new and innovative that there was a Nobel Prize for, which was the MRI about 4 decades ago, 4 decades later, today, it's very clear to us where an MRI is an incredibly useful technology, for example, in spinal cord compression, and where it's a useless technology, for example, in pneumonia. And we don't know that for health AI right now. So I think a lot of the work of the next decade is going to be figuring out where that technology is going to integrate within our clinical practice. Who is going to lead that process, I think, is an important question. So is that going to be led from within Canada, or is it going to be imported like much of our technology from other places? And I'd like to make an argument that we have the opportunity to be a leading jurisdiction for how that technology is considered. But we are starting to see some of the shifts occurring that mean that that technology may eventually be largely imported. And I think some of our other speakers today are going to speak to the sovereignty threats around the fact that it's going to be imported. What I'd just like to flag is that strictly from a clinical perspective, there is a threat to patient care as well, because we know that these kinds of algorithms can perform best when they are optimized within the populations in which they're developed, rather than imported from populations that may not look very much like the Canadian context. And that could be because of the ethnic, racial diversity of the population. It could be because of the model of healthcare delivery. But ideally, you want these algorithms to be brought in to be developed within a Canadian context and optimized within a Canadian context. Aside from health AI, I also want to just highlight the opportunity with this kind of data for things like clinical trials. So the rise of large clinical data repositories has meant that clinical trials can be done at scale much faster, and with a larger degree of generalizability than what was historically possible. So for example, using passively collected health data, one estimate suggests that trials can be done at 80% lower cost, and they can be done at scale across a system. So you get more people participating, you get answers faster because they're much larger, and you get a more diverse, inclusive data set. That means that the insights you generate from that are more exportable to other populations. I'll give you a couple of examples on that front. In the United Kingdom now, they are doing trials where every single person in the country who's eligible is being contacted because of their electronic data. They're saying you're eligible based on these criteria. Would you like to participate? They were able to reach, for example, in an early cancer screening trial called the NHS Gallery trial, they were able to access 1.5 million people in the United Kingdom who were eligible, invite them to participate, and then randomized about 150,000 people. The same thing is being done in Denmark. And so these trials are accessing people at scale across the population. They're also being more inclusive. They're also happening faster. The UK example, that trial happened at triple the rate of a typical trial in terms of the recruitment. Okay, so that's the opportunity that's emerged. And a lot of that is because of the digitization of clinical data. So when we admit someone to hospital now, thousands and thousands of data points are being generated in near real time as we're caring for patients, lab tests, dictated notes, electronic vital signs, imaging both the report tests and the actual imaging file. That data is largely what's being used for things like the health AI example that I mentioned and for things like trials. And there's been a race globally to try and harness that data. You saw just recently a $1 billion Canadian announcement in the United Kingdom to use that kind of data for innovation. The European Union's invested $1.5 billion. The United States has invested over $500 million in that specific kind of data innovation driven by clinical data. As of yet, there has not been a parallel large-scale investment in Canada to use that kind of data. Our group is the largest group in the country doing this kind of work. We have supported over 1,000 clinicians and scientists. We've recently received a $30 million investment from Innovation Canada to do this kind of work. But as I mentioned, the numbers are in the range of $1 billion in other jurisdictions. So at that scale and competitiveness, Canada has not made a similar investment. I would say that we need to recognize that Canada could be a leading jurisdiction for innovation using this kind of work. And we argued this in our Globe Mail op-ed. If you combine 40 million people into a single data set, given the high quality nature of our data, so the data generated in our health system is very high quality in terms of its accuracy. Obviously, getting it out with that accuracy is part of the technical challenge. We have a single payer system which is inclusive of all people, unlike, for example, the United States, where you lose people because of insurance status. And we have the most diverse high income society on earth, meaning that the insights generated here are more generalizable to, for example, a Chinese population or an African population or South Asian population than similar work done, for example, in Denmark. Finally, we have globally leading AI scientists, Jeff Hinton, Richard Sutton, so the Nobel Prize and the Turing Prize just in the last year. Our clinical trialists have the third highest output total of high impact studies in the world. So that combination of population size, diversity, high quality data, if we could, and the talent of our scientists, if we could build the infrastructure, that Canadian advantage would arguably make us the single best jurisdiction in the world for both health AI development and trials. And so then we lead to today's conversation, which is the barriers and the challenges of getting that data into a single accessible ecosystem or data set. I would argue that it is not a technology problem. It is a political will problem. You're seeing other jurisdictions reach ahead in this space, and we need to make the case to the public of the value in first access to therapeutics, the best algorithms, but also importantly, the economic opportunities that are going to come from this area of innovation. So I'll stop there and look forward to hearing from our other panelists.
Great, thank you so much. And we'll turn that over to Dr. Wilson.
Thanks. So thanks, Kim and Fahad, for your leadership on the health data file over the years. You positioned Canada well moving forward. I agree with your comments, Fahad. We could be a world leader in this, and something you passed on before about 1 in 4 VC dollars is in health is now going to health AI, and unfortunately, we may be in a position where we do the discovery and other people gain the benefits, which has happened all too often in this country. So I have many hats. One of the hats that's relevant here is I'm the co-founder of a company called CanImmunize, the digital immunization company. And we were actually one of the first healthcare companies to use the Canadian AWS servers. In fact, AWS wrote a case study about us using their servers. And the motivation for using servers on Canadian soil was there was a belief that this could protect us from the USA Patriot Act. And that came in after September 11th. And it gave the US government the ability to access health data for the purposes of surveillance of individuals for national security purposes. Those type of concerns sort of receded to the background over the last several years, but unfortunately, things have taken a bit of a turn for the worse to the south of the border with respect to our relationship with our neighbors, and concerns about our data and our economy and our sovereignty have all reemerged of recent. And still at the forefront are the concerns about our data being accessed for privacy and security issues, either through the USA Patriot Act or the Cloud Act for surveillance. I just heard that the US may be hiring Palantir to conduct a database on every American citizen, and Palantir is heavily involved in data in the UK and health data, and there's a lot of concerns in the UK now emerging about Palantir having access to that data. But the other concern is that apart from surveillance, the US may be trying to use our data and monetize it to support the development of AI algorithms and position the US further as a global leader in AI, which they've explicitly stated is their goal. And as Fahad said, we have the best data in the world. So, it's population representative. If you go to HMOs in the US, that does not capture all the socioeconomic strata. And ours are far more comprehensive, far more representative. It's a gold mine for developing these algorithms. And I can imagine a lot of American companies, the US government would have a substantial interest in leveraging this data to further the interest economically, healthcare-wise of the US. The basic issue of this health data resides largely on US servers, AWS, Google, and Microsoft Azure. And we know Trump likes to use legislation, shall we say, creatively to achieve his goals. So there may be loopholes in these existing laws that he could use to access our data or permit other companies to access our data, which creates risks for Canada in many ways. So what safeguards do we have? I think ultimately the goal is to have sovereign Canadian data servers, but we need that could take a while for them to have the efficiency and functionality of the US giants. So other steps, data encryption is one, and that's what the cloud servers will tell you, that data encryption and providing the secure key to the individual provides that security. But my understanding is if the data is manipulated on the cloud, which it often is, it needs to be de-encrypted for that manipulation. Snapshots can be taken, so that does still make that data potentially accessible. Then we come back to the issue of data residency or data localization, and that's sort of where this journey started. And when this issue with the US reemerged, I was wondering how secure is the data on US servers on Canadian soil. And that's when I know Michael Geist is the leader in this, so I reached out to him and just sent him an email, said is this legit? It doesn't seem to make a lot of sense that just because it's on Canadian soil, if it's a US company, it would be secure. And he shared with me an article he wrote 20 years ago where he had discussed this very point and came up with some suggestions that could protect our data. So I think at this point I'll hand it over to Michael to discuss his thoughts.
Okay.
Take it.
Okay, I'll jump in. Okay, well, thanks very much, and thank you so much to the Center for the invitation to participate. That's about as good a setup as I think you could possibly ask for. I'll start just by going back for just a moment. Where Kumanan mentioned how this issue emerged, or this issue around essentially unconsented access to data by, let's say, predominantly U.S. authorities is where the concern was prominent post 9/11 and then sort of receded in the aftermath of that. That from a Canadian perspective, that issue and the sort of the spark that led to the piece that Kumanan mentioned occurred to actually involve BC health data back more than 20 years ago. And at that time, there was a move towards outsourcing some of that data. It became clear that the two providers that were in line to potentially get that work were both US based. I think it's fair to say that the union whose workers would be most affected by this saw an opportunity to raise this as a public issue, and so they did. And this question of was that data potentially at risk given some of that US legislation and the likelihood that it would end up in the United States. And we ended up with cases and investigation by the BC Information and Privacy Commissioner. I see Michael McAvoy is on this call. So BC began to examine these issues, and I think it's worth noting that at the time, the response from many of the cloud providers, and it's fairly nascent at that point in time, was, well, you can't localize the data, was largely what they were arguing at that point in time. That they argued that they were as efficient as possible. The data might go in a million and different places, and you never really know where it was. And this notion that somehow you could localize or ensure that the data was resident in a particular country was technically not feasible. And so legislation along those lines, it was argued, didn't make any sense either. Ultimately, a number of provinces did establish legislation that for particularly sensitive data, including at times health data, that there is a requirement to localize. And it turns out that this wasn't as technically infeasible as suggested, that in fact, if there was a business case to begin to establish domestic cloud services and provide assurances to potential customers that that data would reside within the jurisdiction. Turns out you could do that. And so now all the large cloud providers, and there are three main ones, Google, Microsoft, and Amazon, all basically provide with somewhat slightly different levels of assurances that they're able to store the data within the country if seen fit. Now, at the same time, we have seen over the last number of years a large push towards greater data localization rules. So this is not just a Canadian issue. We see many countries move forward or try to move forward with data localization requirements, oftentimes for good reasons. The argument would be in many of those instances that the effectiveness of domestic privacy rules is enhanced if the data is local. We saw a variation on that last year when federal government issued a ruling that required TikTok to leave the country. It said the app could stay here, but the offices had to exit Canada. And when the Privacy Commissioner of Canada appeared before House of Commons Committee on the issue, he acknowledged that his ability to enforce the law was enhanced when the company was resident in the country. And I think the argument is that the same is true if the data is here as well. It is simply realistically more effective to apply Canadian law if you've got the data local. It should be noted that there are some countries that may examine or pursue data localization rules for far less benign reasons. They may move forward with it because they want to increase the level of surveillance that they engage in their own citizens, and it's easier to do that if the data is local here. So there have often been debates around these kinds of rules, sometimes pointing to some of the risks associated with them and at times pointing to some of the benefits. I think it's fair to say that the US has oftentimes opposed data localization rules, in part because it's a prime beneficiary of data flows, and many of the servers are themselves located in the United States. So those are the kinds of rules that are in place. The question, and I'll just speak for another couple of minutes, we can get into it more during the discussion. The question is whether or not that's enough. Is it enough to say that your data is residing in Canada? Does that provide the level of data sovereignty or security over that data such that Canadian rules might apply and we reduce the potential risks associated with that data where it might be accessed in another jurisdiction? And the answer is by and large no, so long as the data is itself retained by a company or organization, but typically it's obviously a company that is itself resident in another jurisdiction or at least subject to another jurisdiction's laws. And so if the three largest providers in this space are all US based, they will invariably make the case that they will take a position of defending the privacy and the data rights of their users wherever located. They may say that they've got Canadian-based subsidiaries, but when push comes to shove, and we see some of the CEOs of these companies sitting behind Donald Trump when he's inaugurated, the question as to whether or not those companies would be in a position, even from a legal perspective, to deny a demand, typically, let's say through a US court, to disclose data wherever located. Doesn't matter if it's in the US, if it's in Canada or elsewhere, could they still be compelled to disclose that data? The response that we have seen in the courts at times is that the only really effective legal argument to counter a potential foreign court order, say a US court order, is what is known as a blocking statute. And a blocking statute is essentially you tell the court that the company finds itself between a proverbial rock and a hard place. It's got the potential U.S. court order requiring it to do something on the one hand, and it has a foreign law that says if they comply with that order, if they disclose the data, they themselves will violate those domestic rules, those other rules, those domestic rules, and will face potential penalties. It's typically not enough simply to have a law that says you can't do this. That's basically what we have right now in Canada. We have PIPEDA, the private sector privacy law, but there aren't strong penalties associated with that. And the fear would be that if a U.S. court would order disclosure, or president through an executive order orders disclosure, the fact that we've got a Canadian privacy law with no real penalties associated with it wouldn't be enough to dissuade a foreign court or otherwise to say, fine, we won't issue that order. What you need is something stronger. Swiss banking laws would be a classic example that's often raised, where there are real penalties that are being faced. And so from a legislative reform perspective, one of the things that is now long overdue, long delayed in Canada, are modernized privacy rules, because our current privacy rules date back more than 2 decades now. And associated with that would be real penalties to at least make a plausible argument that data residing in Canada, even if held by a foreign-based company, would still be subject to real penalties if it disclosed that data, and potentially be able to convince, let's say, a U.S. court not to issue such an order, given the ramifications of what that order would mean. So that's a fairly quick, I hope, sense of where the legal framing is, and some of the potential, at least legislative reform solutions to try to address the concerns.
Great. Thank you all so much for those fascinating, maybe slightly unnerving comments to get us started here. So, I mean, I think the message we're hearing is the digitization, the near real-time data collection, the deep kind of data we have. We have a diverse population in Canada. We do have very good data, even though it largely exists in provincial and territorial areas, and there's all sorts of challenges and issues with making them interoperable. But if we can get around that, all of this is an excellent base of information for innovation, for being a leader internationally and making things happen within Canada. In order to do this, we need infrastructure, and ideally, as Fahad said, a single point of access to this, and that this is not a technological problem there. We know how we could build something like this, but there is a political element to this. And of course, that stretches across the borders of our country. So this is not just a political problem, as in small p politics within Canada. It stretches across certainly to the US and other countries involved. And this has to do with the current infrastructure available to us with clouds. So I think, one of the things that we just ended with there is that maybe Swiss banking laws rather than Swiss cheese that we have now might be a better way to go. But what is I'm going to throw this to all 3 of our speakers. What's the window of opportunity for Canada, and how can we best organize ourselves to get through that window before it closes?
Maybe I'll start. So, I think obviously, oh, sorry, Fahad, did you, or, so obviously the frustrating thing here is we have, Donald Trump says he wants to make us the 51st state, and he says the way he's going to do that is to economically damage us. And then if at the same time he's using our data to increase the wealth of the US, while at the same time we have laws in Canada that are preventing us from doing that with our data. I mean, this seems to be a very unacceptable situation, particularly in the circumstances we're at, and having our data accessible in a safe, privacy compliant manner for the purposes of supporting Canadian companies, I think needs to be a priority as we move forward. We need the tax revenue from those companies to support our healthcare system. So, I think we discussed sort of the interim measures of mandatory encryption of the data localization, as a measure, the blocking statute that Michael has suggested, but ultimately developing sovereign cloud servers is going to be important. And I understand the EU is really moving forward with this in discussions with, I think, Australia and such, but that's not super easy thing to do.
Thanks. Go ahead, Fahad.
Yeah, I mean, I think just to add on to Kumanan's points, and I'll say that Michael and Kumanan's Globe and Mail op-ed, I cite it in nearly every talk I give now because I think you have to acknowledge at this point that things are moving so quickly that the real sovereignty threats are moving at a pace that we may not be able to address them as effectively even a year from now than now if we start to put the appropriate steps in place. So in terms of the window, I honestly, I unfortunately hate to be doom and gloom about this, but it's already started to close in terms of the opportunity to be a leader and to maintain our sovereignty in this space. And the reason I say that is that we have been trying to put together proposals, I think, for the last nearly about 4 years that have been overlapping in this space around data, the AI opportunity trials. And so as we do those literature reviews every year, it's been just striking to see the advances that have been made globally in other jurisdictions. So just in this last 5-year period, we've had the example that I mentioned of the NHS Gallery trial, which was National Health Service UK data can now be used to find all eligible people in the country, contact them, randomize them, follow them passively. That trial is already 2 years into follow-up. So this is not a theoretical idea. Sanofi has an extensive partnership with the government of Denmark where hundreds of thousands of people are being randomized to the next generation of flu vaccines, vaccines that are paid for, by the way, by Canadian taxpayer dollars. So $1 billion investment in vaccine manufacturing in Canada, which I was thrilled to see. Those vaccines, the final benefit end of that pipeline, the evaluation is not being done in Canada. Those vaccines are shipped to Denmark to the evaluation in partnership with the Danish government. And then in the pandemic, I think very, very much close to many of us still, the example of Pfizer's partnership with Israel, where they did the rapid evaluation over 500,000 people of the mRNA vaccine. This is all in the last 5 years. So this is the pace of change. So these are no longer theoretical ideas. These are countries that look very much like us, moving rapidly ahead. And what we hear from the private sector, I was at dinner last week with the head of the vaccine portfolio for Sanofi, and he said, what you need to tell the public is that the changes are not linear, they're exponential. So these investments are happening at a pace that 1 year from now and 2 years from now is not just a linear change. The amount of investment that's going in, anchoring resources, human expertise is enormous, and it's going to be very difficult, despite these endogenous advantages we have, the diversity, the size, the quality of the data, the scientists. Those things will only carry you so far, and once you lose this window, it's going to be very hard for Canada to claw back into the space. And then I'll say the sovereignty idea, once we become relevant, once we become dependent clinically on algorithms that are developed elsewhere, clinicians are very, very inertia prone in the way that they practice. It is very hard to get them to shift their practice. So once we become reliant on technologies that are imported from elsewhere, it'll be very hard to shift our clinical practice. And that will be at the loss of the economic opportunity for Canadian innovators, but also at the loss of our patients, because those algorithms, technologies, first access to therapeutics will not be as good for Canadians if they're imported as if they are developed here.
I'll just jump in. I mean, those are really compelling examples of the risks that, in a sense, the risks that we face, or at least the opportunity lost from a Canadian perspective. I will say that the notion that we need sovereign compute as opposed to sort of some of the sovereign kinds of activities and trials that was just cited. Sovereign compute, as Kumanan mentioned, is going to take a very long time, and there are risks in shifting as well. I mean, the simple reality is that the largest providers are large not just because they're able to leverage that size, but they also are able to provide a level of security over data that most can't. And so the idea that we can simply jump into a Canadian-based server and offer up an equivalent level of security over that data is a bit dubious, to be honest, at this point in time. It is hard to compete with some of these players. And that's one of the reasons I've been more focused on a combination of some technological solutions. So encryption by default would be a classic example. But beyond that, establishing sort of a regulatory framework around this. And it strikes me, even with some of these sorts of examples, if there are interprovincial barriers that exist, those need to be addressed as well. So a lot of that does fall within, have we established the kinds of frameworks that can facilitate the sort of activity while providing people with the assurances that their data is appropriately safeguarded, or are we faced with a situation where we move so slowly? I mean, privacy reform is a classic example. That 5-year window that was just mentioned about how fast things are changing, That's pretty much the 5-year window that we've been debating the latest privacy bill that died on the order paper when we had an election call. And so we measure even basic kinds of reforms in 5 to 10-year cycles when it comes to some of these issues, which I think, to Fahad's point, is just not nearly fast enough given how rapidly things are actually happening on the ground. And those that make the investments, are engaged in some of this activity, aren't prepared to sit and wait around until you get your regulatory house in order.
Okay, so thank you for all of that. It puts a lot on the table, but here would be my reflection on what you have all just said. The window is, it is still open, but it is starting to close, and this is what windows do. They open for a little bit and then they start to close again. The changes are coming fast. We need, ideally, we would have sovereign computes, but we would also, but we don't want to depend on that. That's not clearly not the only answer, and it may not even be the best answer over the longer term. I don't think, Michael, that you would suggest that building regulatory and legislative frameworks is necessarily easier or faster than the challenges of building a technological sovereign compute infrastructure. I think both of those sound like necessary long-term kinds of things. So if we have choice A and choice B that both have this kind of inertia, long-term, we need to move fast, but we need to do things differently, how, like, where would you start? What would the first priority be now, and who do you think needs to be activated to get some of these things done?
That's a great question. I'll start by saying, in some ways, because this issue touches on multiple areas, obviously touches on health policy in this case, but not just that. I sit on a fintech advisory board for the Department of Finance, and we have a very similar conversation, but in the context of injecting competition in finance and concerns that some of our players in Canada are similarly falling behind the rest of the world, and that much of our financial data is ultimately going to be controlled by someone else, and the services that we rely upon will be controlled by someone else as well. So we're seeing this happen in a number of different places. I guess one of the things I would say is that the government's decision to appoint a new minister for AI and digital innovation, Evan Solomon, at least hints at the realization that unless there is someone that is at the cabinet table charged with leadership in this space across potential multiple disciplines, it's very hard to bring together all these different issues together in a way that we are moving on multiple fronts at the same time. I mean, to your point, we have to be able to walk and chew gum at the same time. We have to be able to move forward on some of the investment infrastructure related issues, but at the same time, focus on skills development, focus on the regulatory piece, and focus on finding ways to partner with some of the leaders in the space. And sometimes that does require at least someone that has both some power and convening ability to try to bring together some of these measures, identify where some of those barriers are. There is some potential, I suppose, that having a minister now directly responsible for some of these issues offers sort of a line of sight as to how we might try to get there. But whether or not this is sort of just someone who's going to spend, and I actually did another Globe piece on this, whether or not Solomon is someone that at the end of the day is just going to sort of stand beside big checks saying government's investing in this program or that program, or be able to leverage this position to actually bring together people in both private and public sector and multiple different levels, I suppose, remains to be seen. It's still early days, but I guess in answer to your question, that's the kind of thing that I think we need, especially when we're competing with sometimes other jurisdictions that may not have as federated an environment where you've got multiple provinces, multiple leaders, and it's very difficult to get everybody rowing in the same direction.
Okay, thanks. Fahad, go ahead.
Yeah, I'd like to just add to Michael's comments that part of this is also making the public aware of the losses that are occurring because of the lack of this. I think that we have spoken about the promise of this kind of data-driven technology as a shiny new future. But from a behavioral sciences perspective, the work of Daniel Kahneman, prospect theory, has really highlighted that humans respond more to loss than they do to gain emotionally. And so I think telling Canadians as loud as we can about lack of access to technology, about lack of access to the newest cancer screening, the lack of access to the newest vaccines, lack of access to life-saving therapeutics during the pandemic, not having the best health AI that's really appropriate for our population. Telling them that story is really important, because without public awareness, it's going to be very hard for us to shift on this, because I think fundamentally a lot of the pressure on decision makers has to come from the public. I often say, using a pandemic example, if my 80-year-old parents in Windsor were hospitalized with COVID during the pandemic, they would be roughly 5 times less likely to be enrolled in a life-saving randomized trial than someone in the UK. That's a problem, so we need to articulate that. Now, I think we also need to say there is no perfect solution here. So we do not know what the perfect regulatory space is around this area. There's a lot that's unknown about health AI, for example. We don't know how IP and commercialization should be handled when you work with the private sector perfectly. These countries have a model, but they're models in evolution. And there's no perfect privacy protecting technologies. Breaches will occur. It's about the processes you take to try and mitigate those. And, we have a social compact about speed limits on roads. The 100 kilometers an hour is not a scientific number. It's a socially acceptable number, a balance between the risk of accidents and the need to get where you're going. And we need to explain that for the public, if we have absolute push towards a perfect regulatory framework, perfect protection, it's like driving the speed limit closer to 0 kilometers an hour. Yes, it's safe, but you'll never get where you're going. We won't get where we need to go as a country in this space, to the loss of our economy, of our healthcare, et cetera. And I'll add that even on this call, I'm looking around, I don't want to name drop, Jill from the ministry and Khaled and Michael and Kuman and Kim, your work across the country. We have privacy commissioners. There's enough people on this call to get a working model that is not perfect, but is functional going, I think, in this area. And I think the argument that we have to make again to the public is that we have to move fast. We may not be as fast as the US, but we have to move fast with that layer of safety as much as we can in place. And I think there is a Canadian compromise that can be reached here, which is moving nearly as fast but safer in the US. That would make us a very attractive location to do this work. But absolute protection, a perfect legislative regulatory framework, it's just not in the cards. It's not possible here.
Maybe I'll just add. So, I think there's a moment now. I think we all agree. Things are happening in Canada that we wouldn't have happened before. The dropping of the interprovincial barriers. I think hopefully, good discussions on pipelines, and we just heard the announcement of the increase in spending for NATO. So if things are, obviously we're prepared to do things we wouldn't have considered before, and so they're. I think if it's symbolic or effective, I'd like to ask you, Michael, how quickly could just an amendment to PIPEDA be to put in that blocking statute? I think that would be a nice announcement for a minister to say that we are going to protect Canadian health data, Canadian data from the US. And then the second thing is, how can we make it easier for Canadian companies to use this data to help Canadian healthcare system and also to provide a growing economy? I mean, so yeah, I think the second one might take longer, but the first one, maybe Michael, you can answer that.
Sure, I can, and I wish I could share like the enthusiasm about let's just get this done. But just last week, the government in 2 bills, its first week of introducing new substantive legislation, put forward 2 bills that have nothing to do with privacy, that in my view would be both should be viewed as strong anti-privacy pieces of legislation. So the border bill that was introduced, Bill C2, includes lawful access provisions, which are provisions that date back now almost 25 years worth of debate, and which include the prospect of requiring various providers, now both internet providers, wireless providers, as well as some of the large internet companies, to disclose information about subscribers, including specific data about their location and time of use, without a warrant and without any court oversight. That is despite repeated Supreme Court of Canada decisions that went in the other direction. And then Bill C4, 2 days later, which is legislation ostensibly about affordable measures, which includes a whole section in which the government has exempted political parties from virtually any privacy legislation at all, explicitly saying that the political parties can use data and not be required to even disclose to anyone how they're using their data if you make that request. And so they are trying to trump a BC case that seeks to apply BC privacy law to the federal political parties. But once you do that, our existing federal laws don't apply to virtually any of the activity of the political parties, and it's basically a no privacy law zone for the data that gets collected by our political parties. So those were both introduced in the very first week of new legislation, in legislation that really had nothing to do with either of those issues. And so would I be optimistic about the government seeing the benefits of bringing forward a pro-privacy piece of legislation super quickly? Not based on the legislative proposals they brought forward just last week.
It's an interesting conversation for first thing in the morning. Someone in BC who might think it's swinging back and forth between, and I think to me this is like sort of emblematic of this whole discussion around health data and AI and sovereignty and so on, is that we have to deal with the extremes, the extreme potential benefit and the risk. And I think it was kind of, I think where Fahad was going is, you know, our motto might be move pretty fast and safely, which is just not quite as catchy as moving fast and breaking things. But I mean, I think you can see why we end up there. So I take it from all of you. There isn't a perfect solution. We don't have a playbook to follow. Everybody is struggling with many different issues. Some of the things that I think you've really hinted at, though, is this really need to bring a lot of different people, perspectives, expertise, issues together. And I think that kind of fits with me with, like, I think this is a little bit like climate change, and when it was related to climate change and some of the things we're talking about, but it's what can an individual do? This is not an individual action problem. This is a collective action problem. And the real question is, how do we get all of the benefits that you're talking about without incurring all of the risks? And layer on top of that, we're in a period of reconciliation in Canada. We know that data have been used to harm people. We know that there is some distrust and growing distrust over the period since COVID of governments and government action. And so how do we, I think, and I guess the other thing that nobody's mentioned yet, but a lot of work in the EU, trying to work across the EU, feels like it has some resonance for how we could work across Canada with some of the provinces and territories, and those relationships having some characteristics of the EU interstate cooperation. So I guess I want to ask, and then I'm going to open things up to the audience for the questions that they want to bring. But two big things would be who needs to be at the table, and is there somebody other than Minister Solomon who might be in a position with that convening power to bring this together so that we can actually have this broader conversation that's needed? Maybe I'll just leave it there. Or anything else you want to add to the conversation at this point. Go ahead, Fahad.
Yeah, maybe I'll just offer a few thoughts, but you know, I'd love to hear what people think about this. I mean, I think that we have to have a vision articulated for this, which has as compelling a resonance for the public as what we've heard around other areas. So we are hearing about one Canadian economy, not 13, about one regulatory approval process, not 13. We're talking about the natural resources that the country's blessed with. I think the public and decision makers think of natural resources of timber, of oil, things like that, and that's appropriate. But would love to see health data enter the conversation as much a valuable national resource as those things are, and that we articulate in this vision. And you know, could it enter the July 1st announcement of that they're pushing towards, that we are, along with these economies that we know about, we are prioritizing this future economy, this future area of enormous benefit to the public of one Canadian ecosystem for health data, one approval process, one portal for innovation, you know, one portal for deployment, that idea. So just getting it into the vision, I think, is really important. I was struck at a conversation recently. We hosted another panel with some of the former deputy ministers at Health Canada and at ISED, and they were just saying that the pace of change in this space is faster than anything else they've seen in their career. And it creates especially thorny problems for decision makers and policymakers because of how fast it's moving. And they think that a model we have to move away from the traditional model of policymaking on this one, where there's potentially a collaborative back and forth approach between large institutions setting internal policies, which can then be leveraged by the province or the federal government to think of as an operational framework, potentially using approaches like a regulatory sandbox, where you mark out the boundaries of what the areas where people are allowed to move, and then you just observe carefully and you watch what happens and you try and draw from those best practices. And you also probably need a coalition of the willing. So I think the idea that all 13 jurisdictions are going to come on simultaneously, 14, I guess, if you consider the federal health data holdings, are going to come on simultaneously is not realistic given the pace of what we are facing. And so probably it's a coalition of the willing approach. It's a few provinces or territories or the federal government coming together, moving ahead and setting a framework that they accept within that regulatory sandbox space, observing, watching carefully, and then working forward. That has to be, so I think pragmatically going for that, but going for that quicker rather than, again, I think the vision of some perfect policy solution, which is in my mind is just not possible here.
Go ahead, Kumanan.
I thought your comment about Europe's an interesting one, Kim. So, we do have solutions in Canada for data holdings, and in the work you've been doing, that Gemini, Kai-Hi, I mean, there are massive, large assets of data here in Canada. They exist, and there are agreements in place, to manage the governance of that data. We also, what was ironic before this whole thing with Trump was that it was easier for Ontario to bring in a law to block businesses from other provinces from doing business in Ontario than the US. We could, because of the free trade agreement, there was nothing they could really do. We had to allow the US businesses in. We may be in a similar situation here. It might be easier for us to do business with Europe and their data, and the provinces working one-on-one with them, entering into, as we try to diversify away from the US, let's look to other jurisdictions and see if there can we come into an arrangements with them, given the value of this data and how important it is, and portability of data, and that sometimes can spur into, a further collaboration within Canada when people start to see that. And that's unfortunately always been the case in Canada I know for businesses, right? Nobody will do business with a Canadian company until they succeed in another country. Maybe we're on that path here as well. And but from what it looks like, Europe has made a lot of progress on this.
Michael, go ahead.
Yeah, thanks. I just wanted to pick up on Fahad's point about the speed of change and the challenge that government has in responding. And I think we saw that, frankly, with the government's first attempt at AI regulation, which was a bill, I think, poorly thought out, that largely just mirrored some of what Europe had been doing, in part because things had moved so quickly, at least in the public's mind, with ChatGPT, for example, such that there was demand to do something, and the government hadn't had the time to fully develop a true Canadian policy that was reflective of the sort of consultation and policy development apparatus that we would otherwise hope to see. And ultimately, that bill's died, and I think is generally viewed as having been a failure and a really poor example of sort of policy, of effective policy making in this space. And so then the challenge becomes, if we are moving that quickly and the bureaucracy is struggling to keep up and engage in the kind of the foundational work that's needed for good policy, what do you do? And Fahad's example of thinking about of regulatory sandboxes or other sort of less risky environments to test policy without the potential concerns that sometimes come with getting things wrong. In the case of Canadian privacy law, it's not that we got it wrong, but 25 years of the same private sector privacy law and more than a decade of trying to reform it highlights just the very long cycles. And this is just not even close to the kind of cycles that we deal with from at least in terms of federal legislation. And so entertaining the prospect of less risky environments where it's basically designed to be a pilot project from a regulatory perspective that invites regulatory innovation, and acknowledges that it might not all be right, but it's worth trying these kinds of things and seeing if there's an appetite and learning from it, and being able to respond much faster is what we do see in a number of other places, especially in the finance area, where fintech development in a number of places has really come about largely through regulatory sandboxes as opposed to broader financial regulation. And the same might well be true here.
Okay, great. Fahad, go ahead.
Sorry, Kim. I also realized you asked a second really important question about the partners at the table. So just briefly a comment on that. Look, of course, the public and patients, but I also think that with the public and the patients are these organizations that represent specific diseases. Like, I think they are very effective advocates. So I'm thinking of groups like the Heart and Stroke Foundation, Canadian Cancer Society, organizations that represent rare diseases. They're able to articulate, I think, in a very effective way, the specific kinds of innovation they're seeing globally, which I think they can really bring a lot of value to the table. We have groups like our Indigenous populations in the country and others that must, of course, have a stake at the table, and especially the ability of extending out these technologies in a way that is potentially widening disparities has to be something that's addressed up front. And I think giving a voice to these groups, we hear from our Indigenous partners that their data structures are so far behind even what we consider to be antiquated structures in the groups that I work with. The large clinical organizations can be very important advocates. So I'm thinking about groups like the Canadian Medical Association, the Canadian Nurses Association. These are the groups that are going to be the receivers and implementers of a lot of these technologies, and having them articulate what they're seeing globally and then what they need in order for this stuff to actually get out to the bedside with our patients. Obviously, academic institutes, the strength of the 3 AI institutes in Canada plus CFAR is unprecedented. So I think as a voice to push this forward. And then I'm going to say the private sector. So if, Kumanan has told me so many times of the nightmares his company has faced, and every company that I have worked with over the last couple of years, our access space in this country makes it so difficult for countries. And I think the Canadian model on this has been, especially with health data, has largely excluded the private sector I would say, to our great loss. Again, the innovation, the energy, the investments that can come from that part of the economy in our society is really important. And then finally, for the ministries, you mentioned the AI, you mentioned our new AI minister, but I would say this is also an ISED issue because of the investment that's coming in. And this is also a health issue. This is going to have serious impacts on healthcare delivery, equity of access, inclusion, access to new technologies. All of these are going to be affected. And again, if we don't articulate, I think the losses that are going to happen in the healthcare sector, we're going to have a hard time both shifting the health ministry's perspectives, but also the public.
Yeah, thank you for all of that. It's a very comprehensive approach to thinking who needs to be involved at a time when clearly it would be, in some sense, easier if there was just somebody in charge who could wave a wand and make all the things happen that you've been talking about. But so those things are sort of pulling against each other in some way. Okay, so and I'm going to invite the audience, if somebody wants to ask a question, please raise your hand and we'll come to you. But I can also keep going until we see a hand come up. So, and I want to note that this regulatory sandbox idea is really, really important, but it raises questions about to have those be effective, you need to have that evaluation and follow-up piece. And I don't know that we have those systems in place, particularly in the health sector. We don't have a fully functioning learning system, despite the fact that we need that to move forward. So I'm going to come back to this idea of like the role of the university, perhaps in particular in this, given that this is organized by a university enterprise. But before doing that, please go ahead with the speaker. I can't read your name.
Oh,
your question. Sorry, yeah, the question. Go ahead.
yeah, I have to fix it so it says Michael instead of Misha.
Oh, Michael. Okay.
Hi, great conversation so far. Question about technology assessment. There's this terrible example of sepsis AI package that was estimated in the US and found to be flawed. And we have now it's called the Canadian Drug Agency, but our National Health Technology Assessment, by and large, is reaction oriented. It does secondary analysis of published papers. It has no capacity to do primary stuff. And particularly the private sector, if things are proprietary or patented, it's difficult for academics or third parties to understand what's really going on. So a bit garbled question, but where do folks think things need to be, or should there be some guidelines or requirements for AI-based interventions to be sufficiently open that a proper third party or independent technology assessment can be done?
Who wants to take that? Fahad, go ahead.
Yeah, good to see you, Michael. I'll offer a few thoughts on this. The Canadian Drug Agency is a really nice parallel for the broader expectations that we have post-market capacity to assure safety for therapeutics, drugs, health technologies. I'll use a pandemic example. We were excited when the AstraZeneca vaccine became available. We had the AstraZeneca vaccine, the mRNA vaccines. We were able to quickly detect in that post-market evaluation period that there was increased clotting with the AstraZeneca vaccine. It allowed us to pull back the use of and then shift towards the safer platform with the mRNAs. That's post-market surveillance. And the idea that using the example of AI, that you need health AI assurance capacity, it's well established in the scientific literature that these algorithms are going to shift in their performance for a whole bunch of reasons that are beyond your control. The sepsis algorithm is a very good example. There was an early warning system about antibiotic prescribing in sepsis that was implemented at the University of Michigan, where once the pandemic hit, because the majority of illnesses were now viral for people who were deteriorating, the algorithm's recommendation to prescribe antibiotics over and over and over again was erroneous. That's just one example, but those kind of things happen all the time. And so other jurisdictions in the European Union, there is a consortium of, I think, roughly 10 countries that have an AI assurance capacity that's getting off the ground. I'll put a link in the chat after I make my comments. In the United States, the largest example is the CHAI, the Coalition for Health AI, which has this AI assurance capacity that they're building. Again, there's a really important Canadian opportunity, both in terms of us creating an assurance ecosystem laboratory almost because of the diversity size, et cetera. We'd be very valuable globally if that assurance work was done here, but also ensuring safety for the public and our patients in using these technologies. And one recent survey showed that more than 50% of the public is worried about the use of AI in healthcare. But that drops to less than 25%, I believe, in a JAMA paper once you explain to them the assurance mechanisms that you have in place to ensure that the algorithm is safe. So in other words, they are very understandably skeptical and worried. They also will shift their thinking. The public will shift their thinking if you can show them that you have a mechanism to detect safety issues, bias issues, whatever. So I think there's a big opportunity here. And you can imagine a future state where if algorithms are developed and someone wants to look for a jurisdiction to establish that they're safe, why shouldn't that be Canada? That's what I would hope.
If I could pop in quickly, I mean, that tags along nicely with sort of some of the efforts around AI regulation, which, at the foundational level, the first part really is transparency associated with algorithms and some of the data that goes into it. So it's an attempt, not necessarily to, at least at some levels, to regulate the AI systems, although there's certainly been some efforts to do that, notably the EU AI Act, which seeks to identify sort of a spectrum of risk associated with AI systems. And you get more regulation, the riskier it gets, and in fact bans certain kinds of systems altogether, given the sorts of risks associated with them. But underlying, even those that are sort of just dip their toe in the water when it comes to AI regulation, is to say that you can't engage in these kinds of assessments unless you've got a sufficient level of transparency in terms of being able to understand what's in the algorithms and the data itself that went into some of that decision making. And so that, I mean, if we talk about areas where you could move quickly, there is generally, I think, a consensus that it's hard to argue against greater transparency when it comes to algorithmic decision making and some of the data that leads to that. Some still might try, given the proprietary nature of it, but there's still an ability, I think, to move forward with those kinds of rules quite rapidly. And if that's sort of the basic table stakes to potentially be a player in there isn't really a lot holding us back to ensure that at a minimum is part of the cost of doing business in the AI space in Canada.
If I could jump in quickly, though, part of the reason for things being slow, Michael, is that there are really powerful vested interests. So that why invest in an AI algorithm if it can't be proprietary?
That's all. That's always the risk. And I think we in Canada, I did a piece on this as well, that we find ourselves stuck in a or positioned in a really difficult space where on the one hand, I mean, it feels like certainly there are many that would like to move more towards an EU style approach with a strengthened regulatory model. But if we're facing or right beside a US market that is rapidly seemingly abandoning many of those guardrails in an effort to simply hoover up as much of the economic benefit that may arise as possible, you got to sort of pick where you're, pick where you're going to land and try to find a way um, to establish what we see as sort of basic regulations that are essential while at the same time ensuring that we're competitive in that kind of global space. I think that there are of course going to be vested interests that are going to have push back against almost any kind of regulation and are happy to be in places where there's very little in that regard. But establishing baseline transparency has been one that we do see in many places. If those same companies are already meeting those requirements in certain jurisdictions, there's little reason to think that they wouldn't meet it in Canada as well.
Okay, Kumanan, and then we'll go on to the next question.
Yeah, just quickly. So regulating digital products is incredibly difficult because they change so fast. I mean, and can we solve the problem? The attempts being made in the US initially was identify level of risk, and for lower risk product, let them get out in the market more quickly, and with the onus in the company to provide proof of efficacy and safety. I guess it really hasn't worked out. They never really got that data back. And now in Canada, particularly for machine learning and such, the predetermined change control plan where companies are supposed to say how are the products going to change over time and report on that is sort of an effort being undertaken here. Again, that might have worked with the older versions of machine learning, but now with generative AI, where it's always changing, I'm not sure how that's going to work. But that's exactly the problem. As soon as they come up with a new regulatory standard, the technology may have changed beyond that. One of the worries is if you do create an over-regulated space, you make it's very difficult for smaller businesses to enter into the market, and then the US giants win again. So like Epic's always going to win this one, right? Because they have all the resources and stuff to claim they've jumped through all the regulatory hoops, whether they have or not, while the smaller companies can't. So it's a difficult balance to strike.
Great. Okay, Maddie, please go ahead with your question.
Thanks very much. And thank you all for the discussion so far. It's been so interesting. I put my question in the chat a bit earlier, but I'll reiterate quickly. I know we had discussed the introduction of the new AI governor, minister, and the introduction of those conceivably anti-privacy bills as well. So I was just wondering if we have maybe any signs of political willingness at the federal level for returning to developing that modernized regulatory framework. And then on top of that, if relying on legislation at a provincial level for these privacy protections is possible as well.
I'm happy to jump at that by saying, well, I mentioned that it's hard to be optimistic given what we saw just last week, as I mentioned, with a couple of privacy bills, or bills that involve privacy. That said, I think there is a general sense that the last failed attempt at the federal level failed, at least in part because of the attempt to be overly ambitious in bringing together both privacy and AI regulation into a single package, and it had the effect of sinking both. I think there is some sense that for a government and a prime minister that wants to be seen as doing things and accomplishing things, that putting forward just the privacy side of that equation might provide a quicker win, and that there isn't a ton of opposition to some form of privacy. Once you get into the details, there's always going to be tensions from various groups, but there's enough of a consensus that something can pass. So I think there is some reason for optimism that we will see federal privacy legislation introduced certainly in, I don't think before the summer, but sometime in the fall seems like a pretty reasonable bet. And I would say that there's a fair amount of consensus that we might see it passed. Whether that addresses all the health specific privacy issues that many people on this call will focus on, I think is a fair question. There's a reason we've seen many provinces move forward with health specific privacy legislation, and there's the ability to get a bit more granular and into some of the specifics that we don't see at the federal level. And so I think there are advantages to see provinces do that. The challenge that we face then becomes an interprovincial issue where if you've got differing sets of rules as between the differing provinces, does that then create its own set of barriers where you've got a set of different rules and it's difficult to comply simultaneously with all of them, or at a minimum establishing additional compliance related costs as you're finding yourself grappling with multiple jurisdictions and potentially some amount of conflict with respect to their various approaches.
Okay, I'm not seeing any the other Fahad or Kumanan wanting to weigh in on that. So I'm gonna, while waiting for somebody else from the audience, I'm gonna go back to a question about the role of the university. And let me preface this by saying one of the things that I have observed in all of my work over the past, I don't know, 10 years or so, is that people do really extraordinary things, but usually within the context of a single institution. Working across institutions, working is just as tricky as working across provincial and territorial boundaries. And so we have really skilled people in cybersecurity and not thinking about kind of going back to the technological sort of standpoint of things within our university institutions, but we're not necessarily adding that up, I don't think, into something that is across Canada, the best of the best. So that's one aspect of my question about what is the role of the university here. It might be in the regulatory policy development space, it might be in the infrastructure development space, it might be in the regulatory sandbox evaluation follow-up kind of pieces, but what should we be doing in our home institutions to help move this conversation and the action needed along?
Yeah.
Go ahead.
Yes, David. So actually, this work we did with the Health Law Institute with Colleen a while back. So we had an M-Health lab at the Ottawa Hospital, and we were creating products, and we were wondering what privacy law applied. So I asked Colleen and to try to figure that out, and it was apparently none did. And that was a strange thing. So PIPEDA would apply to businesses, and PHIPAA would apply to health data custodians. And we were this lacuna that was nowhere, which is good and bad. It gives you freedom to do stuff, but it also creates risks. So, in that sense, there are opportunities for innovation in the academic space that prior to, as long as there's a path to commercialization or sustainability of recurring revenue. The risk of doing stuff in academic centers is that absence of recurring revenue and being able to support the updating of the algorithm, which then create risks because you're exposing people to data that may no longer, or algorithms that may no longer apply. So I think there is a way probably to maximally utilize universities' freedom that they have, but as long as there's a path to sustainability, which I don't think we have done a great job of in Canada so far.
Great. Fahad, go ahead.
I may turn my video off. I'm in a part of the hospital that has very spotty Wi-Fi just to maximize voice. Does that sound okay, Kim?
Yep, you're fine.
Yeah. Okay. I was mentioning some of the surveys that have been done around AI, and Canada, at a natural set point among comparable countries, actually has a lower level of trust overall, the Canadian public, of AI technologies, but the sector of society that they trust the most in to govern, oversee, and responsibly innovate is the universities. And so only a third of Canadians are willing to trust AI, but 3/4 of Canadians believe that the universities are a place where the innovation and responsible use of this technology should be pushed ahead. So I think universities have a really important role. And this goes back to the collaborative idea for policy development with provincial and federal decision makers. This specific area around health data and health AI has been the area where in my not extensively long career, but in the last 10 years, I've seen the most collaborative efforts where those policymakers are reaching out to us or we're prompting them with issues, this back and forth. And I do think it's a model that we need to exploit the trust of universities as by the public, the desire of decision makers to work with universities and acknowledge that this space is moving very quickly and they need that kind of outside of government expert input, which is not the commercial sector, to try and help them understand how to innovate in this space responsibly, but also against the pressures of needing to move quickly. And then finally, in the survey, one of the areas that had the lowest level of trust was the private sector by Canadians. This is a problem. Again, I just want to say again that I think we need to do a better job of integrating the private sector into these conversations. We're clearly seeing in every other jurisdiction that significant advances are being made in that collaborative approach. And we can't pretend that it's going to be possible, especially as a country that underinvests in research on a per capita basis compared to many other countries. If you don't invest in research yourself and you exclude the private sector, well, what's left? So this is the problem I think that we face. So I think as academics, I have, I'll say here, I have no disclosures. I've never been a consultant or taken an honorarium from the private sector. In Canada, that's a badge of honor. I spent 5 years in the United States, and my bosses there would sometimes ask me if I'm doing enough to bring in the private sector to think about scale, innovation, expanding on what you're doing, because there's an acknowledgement that they're an important part of the story in a way that we sort of tend to exclude more from a cultural perspective here in Canada.
Yeah, if I could just quickly just expand on that issue, I was going to highlight some of the challenges we've faced, I think, in terms of ensuring that those academic voices have influence in terms of where policy is at. And we've had, obviously, it's well known, we've got some of the leading AI scientists anywhere in the world in Canada, and they have tried to be at times vocal on AI regulation, but I don't know that they've been particularly successful. Part of it may be that they're great scientists, not necessarily policy advocates, and play in the space of trying, how do you influencing government policy is a different skill set, and that isn't always the same as what you're trying to do in terms of breaking new ground when it comes to AI. But I think part of the problem has been a disconnect between what takes place from an academic perspective and what's taking place in the private sector from a commercialization perspective. I was speaking to one of Canada's leading AI companies about the consultations that the government did around some of its AI regulation. As I mentioned, there wasn't a lot, but they did at one point in time try to bring various groups together. And I think the number that they told me was that it was 17-2. 17 people were there from academia, civil society, who were by and large focused primarily on regulation, and there were just 2 perspectives on the commercial benefits of AI and what needed to be done to focus on that. And if that's the kind of conversations that are taking place, then it's little wonder that we're struggling on some of the commercialization piece, because those perspectives are barely included as part of some of the debate.
Great, thank you. Michael Wilson, go ahead.
Yeah, Kim, on the business about the university, there's a long history of the Canadian Foundation for Innovation funding physical things and the other granting councils operating. And that gave rise to a blue ribbon committee a couple of years ago that recommended not quite blowing up the granting council structure, but creating something called a capstone. And that was in the last budget, and that was also in the newly elected government's campaign platform, which potentially could signal a non-trivial change in the way data, I've been focusing more on the data than the AI side of things, are handled here. But it strikes me that there's a tremendously important role, and you're directly involved, Kim, with the SPORE initiative out there at UBC to harness our health data. I remain greatly disappointed that both the Canadian Longitudinal Study on Aging and the CanPath, as it's now called, hundreds of millions of dollars have been invested in these data sets, and we still can't get cross-provincial data shared and, centrally accessible. So maybe the capstone people, when they do their tour d'horizon, will see that part of big science is not just cyclotrons and telescopes, but health data.
Yeah, thank you for that. And I put the link to the colloquially named Bouchard report in the chat. It's an important conversation, but I will just editorially myself say sometimes it feels like this is putting form before function. That I think will be a challenge. Okay, so there was a hand just up now. Maddie, did you want to, or was it somebody else? So hand up, hand down. Okay. Anybody else want to weigh in on what Michael's added? Okay, Maddie, go ahead.
Yes, sorry, I pressed the wrong button there prematurely. I had a different question just to inquire about, as we've been kind of speaking about the Canadian trust in AI when it comes to their health data. And I was just wondering if anybody had any thoughts about how, on top of domestic data sovereignty, how individual data sovereignty would play in. Is that something that we want to look to improve in Canada alongside the modernization of our regulatory framework? Or is that more seen as maybe a barrier to some of the technology that we're trying to develop?
Great question. And I'll just invite all of our 3 panel members, just because unbelievably, we are getting close to the end of the time here. So please, if anything you want to say in response to Maddie's question, but any closing comments you might want to make as well, just go ahead.
Maybe closing comments related to this. I think the best possible scenario is Canadians have access to their Canada's health data for individual access, for the betterment of the health system, for AI algorithm generation for Canadian companies. And nobody else had that data. The worst possible scenario is, the next scenario is, okay, that data is available to no one if you really want to make sure, like security, or it's available to everyone. Unfortunately, I think the scenario we have right now is other countries may have the data and we don't. Like, I think that's my worry, is that right now we have the worst possible scenario. So when you take it to an individual level, I think that's sort of, they want their data, and okay, maybe if Canada can use that data, that's great. But I would suspect most individuals would be quite concerned to know that their data could be accessed by other countries and other companies that are not Canadian. I think that would be probably the biggest fear that they'd be experiencing right now.
Great, thanks. Fahad, go ahead.
Yeah, I'll just say as a closing general comment, thank you again to the organizers. What a privilege to be part of this panel. Obviously, an incredibly important issue, and I think an opportunity for Canada. We are thinking of doing things as a country now that I think historically were not possible. Whether it'll happen or not, we shall see. But at least the ambition is there, and I really believe that this should be at the very highest pedestal of ambitions for the country right now. It really is one of the things that we can clearly lead in. And there's not that many of those things. And we have these advantages, which are significant advantages, but they're not forever advantages. And so I do hope that the ambition of leadership in this space is put up for policymakers as one of the major priorities for the country right now. To Maddie's question, my sense is that surveys that have been done in the public, I think ICS has done a lot. I think HDRN has done these. People, I think, are actually in many ways much more progressive in terms of wanting the infrastructures, data infrastructures like these to support better care for them and to support better access. And I think that we should keep that desire, thinking about a stewardship model of data and moving away from the custodianship model. We need to balance those real important desires of Canadians against legitimate worries about privacy and use of data, which is also expressed by Canadians. So in other words, there is clearly their worries around risk. There are clearly their desires for better access to care, better access to technology, more precise therapeutic decisions. And so these technologies that we're talking about, recruitment into trials for first access to therapeutics and new drugs, health AI that's more precise for your own individual decision making, that's part of the benefit argument that we need to bring forward. And again, it's this idea of the Daniel Kahneman prospect theory, like we need to articulate the losses for the public as much if they don't have access to these things as much as some theoretical gain. So the idea that algorithms that are not as good for them are going to be used if we don't do a better job here. And I think there is a model forward that will. I think the model that we can take forward is one that can embrace those opportunities or losses for the public as much as articulating the risk, which I feel that a lot of these conversations often come down to the risk. So that's your specific question, Maddie. And I don't think you were arguing for the risk. I just think that the conversations often would spiral around the risk rather than the opportunities, the benefits, and the losses if we don't move.
And I'll just quickly wrap by also thanking the Center for pulling this together. It was a really fun conversation. And just note that, well, I think I think it should be obvious that, of course, users should have appropriate levels of control and remedies where their information is misused. But I'd be reluctant to suggest that somehow that really solves the broader systemic limitations that might exist in privacy. There's a good reason that most people never bother reading any sort of privacy policies. And it's not just that they're indecipherable, it's that you don't really have a choice anyway. And even if you were to try to work through them, you would have a hard time understanding, well, what are the real limitations here? And so that's why we need effective higher level regulatory systems, not depending on people to spend hours wading through privacy policies to determine whether or not they're comfortable with this use or that use, because in most instances, they're not really going to be able to fully appreciate the implications of what the policy means, and the amount of time being spent, given that you're facing this again and again and again, is better spent doing other sorts of things. So it's up to the policymakers and the politicians to establish frameworks that meet people's reasonable expectation of privacy, is the baseline of the law often suggests.
Great, thank you. Thank you all for those were wonderful closing comments. I'll just wrap up by saying that we always, I mean, if you look at the history of any kind of technological development, we end up with technologies getting ahead of our ethical and social considerations, the regulatory structures, the privacy structures, and so on. So this is an ongoing challenge, but it has some very special nuances and considerations in this space, this very, very fast moving space. And we didn't get to any conversation about the climate, but I do think we have to think about environmental impacts and as we have these conversations going forward. So I think health data are a natural resource that is part of our internal trade economy. It's part of our external trade economy as well. We want the future to belong to us, but we are going to need to act fast now to determine our own future and to keep ahead of or to have some say in what that looks like. This is going to mean requiring us to do things differently and to do them differently together. It's much more of a collective enterprise. So with all of that, thank you for being here today. Thank you to the organizers and Vanessa in particular for inviting me to be part of this. And I hope you will all be part of creating the solutions that we need for this moment and going forward. Thanks.
Thank you very much, Kim, Michael, Fahad, and Kumanan for joining us today. This has been just an amazing conversation, and we look forward to continuing the conversation. Thank you, everyone, for joining us.